Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today we're going to talk about men's health issues and the things all of the men listening and the women who care about those men need to know to stay healthy. So our guest today is Dr. Adam Cole, a urologist at Northwell Health Smith Institute for Urology. Dr. Cole, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Hi, thank you so much for having me.
First of all, before we get started, I hope you're doing okay in light of the pandemic. And has the virus affected you personally at all?
Yeah, thank you so much for asking. You know, it has. I've had two family members that have contracted COVID. This was a couple months ago, but fortunately, everybody is doing well. But, you know, we're still adjusting to it. It's still part of our practice. You know, we screen all the patients that come in here and all the physicians are screened. So it's still something that is part of our day-to-day practice, and it's certainly affected us. How about yourself?
Pretty good. I've been pretty good being able to, immunize and to keep the distancing and masking, all those things that we teach, staying safe. So I'm glad we both are doing well in light of this pandemic. So tell us a little bit about you and what made you become a urologist and specialist of men's health.
Yeah, thanks. So, I knew I wanted to be a physician when I was in high school and college. I knew I wanted to be helping people. I was always interested in science, and it was a nice intersection of those two passions. And when I was in medical school, I got exposed to urology. It's not something that a lot of students get exposed to, but I happened to have a class where I had a urologist, my teacher, and I was really interested in what he was talking about. And I shadowed him. And the thing I found really interesting was you're talking about very sensitive issues with men, things like erectile dysfunction, things like leakage of urine. And they're very personal issues, very issues that can, have a lot of stigma associated with it. And you got to interact with patients and really delve into these complex and challenging issues and really help people through issues that are tough to deal with and that men don't like to talk about. And it was really nice to see that personal interaction. And I found that the urologist I was with really enjoyed what he was doing, and the patients were really appreciative. And as I got more exposed to the field and did some research and interacted with him more, I just came to love the field and love helping men and women. Women have lots of urologic issues as well, but got to enjoy helping men and women with these complex issues.
So what would you say is the top health concerns with men? What do you see mostly in your office?
In terms of their health conditions...
Recording in progress.
There are health conditions that specifically affect men, things like prostate cancer, testicular cancer, low testosterone. But the number one cause of death for men is still heart disease. It's a major killer. It's a major public health issue. And as you know, I'm a urologist. I mostly see men and women with urologic issues, issues relating to urination, cancers of the urologic system. But as a physician, I can't stress the importance enough of having a healthy diet, healthy lifestyle, regular exercise to decrease that risk of heart disease.
So what would you say when you see men in your office? What are some of the screenings that you do or men can do themselves as it relates to urology?
Yeah, so there are screenings that we can do in the office here, and there are also screenings that men can do at home. So something that men can do at home that are listening is testicular self-exam for testicular cancer. So, compared to other cancers like breast cancer, colon cancer, testicular cancer is a little bit more rare. And, the American Cancer Society estimates maybe around 10,000 cases a year, or 10,000 men are diagnosed with testicular cancer. But it's the most common cancer for men ages 20 to 40. And usually, unfortunately, when it's diagnosed, it has very good cure rates, around 95%. So that's why we recommend regular testicular self-examination about once a month. And usually we recommend that when men are in the shower, they do this, both because, one, you're already naked, but two, because the steam kind of relaxes the scrotum a little bit. We recommend just rubbing your fingers over your testicles. You can feel up the cord, and you're looking for hard, smooth lumps or round bumps. There are lots of things in the scrotum that can sometimes cause lumps or bumps. And what we recommend to all men is, if you have any questions at all, we have experts on testicular diseases, other pathologies of the scrotum and testicles. So if you have any questions at all, please come in and see us at Smith Institute for Urology. We'd be happy to address whatever concerns men have.
So how prevalent is prostate issues, prostate enlargement, prostate cancers? Who comes into your office and what do they look like often, these men, in terms of age and background?
Backing up, I guess I can just kind of quickly talk about what the prostate is, because some men, don't really know. Everyone knows what their lungs are and the heart. So the prostate is an organ. It's about the size of a ping pong ball, and it sits under the bladder. And the urethra tube, which is the tube that connects the bladder that you pee out of, it wraps around the urethra. And what its function is it helps with reproductive health. So it helps produce fluid that's important for sperm, that nurtures the sperm, and is important in reproductive health. But as you age, it can cause some problems. It can cause prostate cancer, as you alluded to, and also enlarged prostate, which are different things. So an enlarged prostate, the average man we see, it's usually men in their 50s, 60s, and this is very common in a large prostate. About 50% of men 60% of men in their 60s have this, about 20% of men in their 50s, and by age 70, about 70% of men have prostate enlargement. And the symptoms that they can experience can be problems emptying their bladder, things like a weak flow, dribbling, or problems storing the bladder, feeling like you have to go to the bathroom all the time, having a sense of urgency, getting up at night to pee. And this is something that's very common, and this is something we see a lot of and something that we can help treat.
So talk to me more about prostate cancer. What are some of the signs or symptoms that coincide with prostate cancer or enlarged prostate?
Yeah, great question. So, enlarged prostate and prostate cancer are different things. So the way that we usually diagnose prostate cancer, now usually prostate, having prostate issues, problems urinating like I was just talking about, those are usually symptoms of an enlarged prostate. Typically in the US, prostate cancer doesn't present with symptoms. Usually it's diagnosed on a blood test. So there's a blood test called the PSA, which tests for a protein that's specifically made by prostate cells. And it can be elevated both when you have an enlarged prostate, if there's issues with the prostate or prostate cancer. So that's a screening test that typically we recommend for men once they hit about 55 years old. And when that's elevated, that can be an indication that there may be something going on with the prostate. And that can lead us to other steps to help diagnose prostate cancer.
So looking at the PSA, is that going to give you specifically whether you can make the differentiation between enlarged prostate or cancer? What is the distinct test for cancer or prostate cancer?
Yeah. So again, great question. So the PSA it stands for prostate specific antigen. It's only made by the prostate. So there's nothing else in the body that makes it go up. So like you're alluding to, it can be elevated if you have a big prostate or if you have an infection of the prostate, but prostate cancer is also what causes it. So, we take into account a man's age, right? Older men in general have bigger prostates and higher PSA. We take into account race. We know that in general, African-American men, Asian men, Caucasian men have different values of normal PSA. But when the PSA is elevated, that's usually accompanied by a rectal exam where we can feel for the prostate, feel if there's any lumps or bumps. And then if that's elevated, typically what we do in that setting is we do an MRI of the prostate. So we can do some more specialized testing to see is there any enlargement, is there any area that looks suspicious on the prostate that we may want to biopsy. And the real definitive way to tell if someone has prostate cancer or not is to do a biopsy, is to actually sample tissue from the prostate and look at it under the microscope.
So if it is that you find that there is cancer cells or that there is cancer of the prostate, is the patient usually have surgical intervention at that point?
So it can be. So prostate cancer, so fortunately for prostate, with regards to prostate cancer, compared to other cancers, it's a more slower growing disease. But when we diagnose prostate cancer, we have to take into account how old the man is, what are their other medical issues. Fortunately, I'm lucky to work at a place like the Smith Institute for Urology, where when we see a man with prostate cancer, we address that man's individual needs, meaning there's lots of ways to treat prostate cancer. There's surgery to remove the prostate. There's radiation to remove the prostate, or to treat the prostate cancer. There's sometimes seeds we can put in a prostate. And for some cancers, actually, there's some cancers that now we know are a little bit less aggressive that maybe we can just monitor and do what we call active surveillance. So we're lucky here that we work really closely with the radiation oncologists, the radiation doctors, the medical oncologists that give chemotherapy. We work really closely with them to come up with a comprehensive plan that is individualized for each patient. So it really depends on the patient. And we treat each patient very individually, and it's oftentimes based on, the patient's desires, the patient's age, all their other comorbidities, and we really try to individualize it to the patient.
You're listening to Your Family's Health on the voice of Nassau Community College 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about men's health issues and the things all of the men listening and the women who care about those men need to know to stay healthy. Our guest today is Dr. Adam Cole, a urologist at the Northwell Health Smith Institute for Urology. So, Dr. Cole, talk to me about this term that I'm hearing in probably social media about the cyber knife. What is that?
Yeah, so great question. So cyber knife is, again, another way to treat prostate cancer. Like I was saying, we have surgery, we have radiation. This is a special type of radiation that can be done. And fortunately, like I said, at Northwell Health, we are lucky enough that we work very closely with our radiation oncologists, with our other physicians, that we can offer the wide array of treatment options. So, I would say to most men, if you have any issues with the prostate, we're more than happy to see you and address, individually what your specific needs are.
Great. I'm kind of changing gears here. Talk to me a little bit about low testosterone and the health problems that leads to.
Right. So testosterone is a hormone that's made by the testicles. It's also made by another organ. A small amount is made by the adrenal gland. And it's important in development, skin, facial hair. It's actually important for bone marrow to help produce red blood cells. It's actually helpful for muscle mass, bone density. And we know that you're constantly producing this, and it peaks around 18, plateaus to 30, and then as we get older, it starts to decline. And we know that men with low testosterone, men in their 50s, about 12% of men have low testosterone. When you get into your 60s and 70s, it gets higher up to 20, 30%. So some of the symptoms that men with low testosterone can have, there's physical symptoms, cognitive symptoms. So physically, less energy, less endurance, less muscle mass, obesity. We also know that low testosterone itself is actually a risk factor for heart disease. There's also cognitive side effects, things like depressive symptoms, decreased motivation, and also sexual side effects, things like reduced sex drive and erectile dysfunction.
So how do you screen for this, and what do you do for this?
Yeah, so screening tests. So again, if men, as they age, are having these issues, men with erectile issues with, decreased libido, decreased energy, we can screen for this by testing a testosterone level. So it's actually a blood test. You get it done in the morning, and we have a normal range. And if your testosterone is low, then we can do additional testing to see if there's other hormonal imbalances at play. Oftentimes, it can be just due to aging. Again, sometimes other hormonal imbalances can cause this. Sometimes it's related to medications. We hear a lot about the opioid epidemic, and one of the side effects of chronic opioid use is actually low testosterone. So there's other things that can cause this. And treatment, as I think you alluded to, usually involves, if there's something abnormal, to correct that, things like hormonal imbalances, and also testosterone replacement.
How about the special concerns that African American or Latino men have? What should they be specifically aware of? So,
African American men are actually more likely to get prostate cancer and more likely to die of prostate cancer. They're about 50% more likely to get prostate cancer and twice as likely to get it. And quite frankly, we don't really understand why this is the case. It's
right.
Complex. There may be social and environmental reasons, things, like nutrition, access to healthcare. And then we also think there's some biology at play, some tumor biology, maybe where the tumor is located. So what this means is that African American men should be screened more proactively. Typically, we recommend men when they're about 55 to get screening. If you're an African American man or you have a family history, then maybe we should start screening earlier. The other thing that we know for African American men is that we should maybe be more careful when it comes to the treatment options. We talked a little bit about one of the treatment options of the wide array of prostate cancer is active surveillance, meaning we monitor the cancer to make sure it's not going to spread and to make sure it's not going to grow out of control. But for African American men, that's maybe something we should use a little bit more carefully because we know the risk is a little higher.
So if an African man or a Latino man is diagnosed with prostate cancer, is it a high probability that their father had cancer, prostate cancer too? Is it familial?
It is familial. We know that prostate cancer, there is a familial component to it. So having a family history, either a brother, an uncle, or a father with prostate cancer does increase your risk of prostate cancer. Now, there have been lots of studies to try to find a specific gene for prostate cancer. And so far, there doesn't seem to be a gene similar to, in breast cancer, there's the BRCA1 gene. It doesn't really seem to be that type of specific gene for prostate cancer. But we do know that having a family history increases your risk.
So switching gears again, how has COVID affected everyone's urologic health?
So, we're getting a lot of questions about this. And this is really important because, there's lots of information out there about the COVID vaccine, about COVID, and you sometimes don't know who to trust. There are celebrities tweeting about, friends that have had reactions. So, we're looking at this very closely. We have patients ask us all the time. And fortunately, here at Northwell, we have weekly teaching conferences that involve medical students, residents, and a lot of my colleagues where we are reviewing all the literature on a weekly basis where we're talking about this. And so far, we found that there's no evidence that the COVID vaccine has any implications on erectile dysfunction or fertility. Now, and because of that, we, are recommending to everybody, and this is, independent of me being a urologist, but just as a physician, that we highly recommend everybody get the COVID vaccine.
So let's talk a little bit about erectile dysfunction. And I know that this is an issue and we do understand the prescribed medications. Who is at risk for erectile dysfunction? How common of a problem is this and how are we treating it?
So erectile dysfunction is a really common problem, and it happens as men age. The quality of their erections and their ability to get erections goes down, and it's really common. So, I would just advise all men out there, again, this is something that is sometimes difficult to talk about, and you may be embarrassed to call your doctor and talk about it, but please do not. We treat men with this problem all the time, and we understand it's a sensitive issue, and we're happy to deal with it. Reasons why it occurs, some of it is age-related change. Some of it has to do with vessels. As you get older, just like in your heart, you can get calcifications of the blood vessels. Same thing happens down with your penis. As you get older, there can be calcifications and blood buildup. As we talked about before, low testosterone. As you get older, testosterone levels can go down. So usually when men have erectile dysfunction, one of the screening things we can do is talk about a testosterone level and check a testosterone level.
How safe are the pills and medications that are taken that are sold on the internet for ED, erectile dysfunction? How safe are they? And should everyone be at liberty to purchase them if they're experiencing this kind of dysfunction?
The pills that are out there, things like Viagra, things like Cialis, have been around for a long time, and there has been some robust evidence testing. But we do recommend that you see a doctor and talk with a doctor before starting it, because there are some conditions and some other medications that interact with these medications where we wouldn't recommend you taking it. For example, men that have heart disease, men that are taking nitrates for their blood pressure, those interactions we sometimes have to be careful about. So it's something that if you're having this issue, we recommend you see a physician and talk to your physician about it before starting this medication.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today we're learning about men's health issues and the things all of the men listening and the women who care about those men need to know to stay healthy. Our guest today is Dr. Adam Cole, a urologist at Northwell Health Smith Institute for Urology. So again, I'm just going to change topics and, we can talk on and on about ED and all of the topics, but let's talk a little bit about kidney stones. How common are they in men?
Yeah, so kidney stones, unfortunately, are also very common. And we know that risk factors for kidney stones, we see that in places where the weather's hotter, sometimes we notice kidney stones because it the number one risk factor is not drinking enough water. So we recommend everyone, and you see here, I have a big bottle of water next to me, is to stay hydrated, because that keeps things flush and helps prevent the urine from getting concentrated with crystals. The symptoms of kidney stones, and anyone who's had a kidney stone knows what they are, can be very bad pain, severe pain, feeling like you're doubled over. And when you have a kidney stone, it's an emergency. If you feel like you're passing a stone, we always recommend going to the emergency department. And when you're in the emergency department, you may see a urologist there. You may ultimately end up seeing a urologist, and it can talk about treatment options, whether or not that's passing the stone on your own or having some type of procedure to try and help you to remove the stone.
So if I'm suspecting that I have a kidney stone, what are some of the symptoms that I may experience? Is it blood in the urine? What else is that you may experience?
Blood. So the number one symptom is usually pain, and usually it's pain in the back or flank where the kidney is located, but it can be pain in other places. It can be pain in the abdomen. It can be pain radiating down to the testicles or a penis even. Blood in the urine, as you mentioned, also changes in how you're peeing. Sometimes we see men that pee more frequently. Sometimes when you have a kidney stone, it can put you at risk of getting an infection. So if you have this and you have a fever, if you're not feeling well, then we definitely recommend you go to the emergency department.
So what about issues that are relevant to those that have cardiovascular illness where they possibly are not producing a lot of urine? Tell me about some of these disease processes that are relevant to the heart, and why does that cause a decreased production of urine? So
high blood pressure. We know that over time, high blood pressure can affect the kidneys, because over time, as the kidneys are seeing more and more blood at a higher pressure, sometimes it can damage the microscopic area of the kidney that filters blood and turns it into urine. It's called the glomerulus. So over time, that can cause damage, and that can be monitored by checking blood levels for your kidney function. And over time, as that happens, you can start to have worsening kidney function and ultimately produce less urine. Things that can be done to help this, again, as we talked about earlier, maintaining a healthy lifestyle, exercise, and diet are really helpful to reduce blood pressure. Trying to decrease salt in your diet, eating more fruits and vegetables. And if you have high blood pressure, something you can see your doctor about, and after you try some of these conservative measures, there's also medication that can be used to lower the blood pressure. And this is something that's really common.
So how often should I be coming to see you, Dr. Urologist, as it relates to my own physician? Should I have a separate visit to my primary care provider, physician, and then come to you in addition to that? Or should I be coming to the urologist on an annual basis or more?
So for men as they get older and have these issues, typically we do recommend seeing urologists on an annual basis. And at those visits, we can talk about Psa screening, problems with the prostate. Primary care physicians have a really hard job that they are managing every part of your medical health at that visit. Problems with your heart, problems with your lungs, every organ system. So sometimes it can be helpful to have other physicians that are just dealing with their specific specialty. Now, for someone who's younger, healthier, if you don't have a urologic issue, you don't necessarily need to see the urologist. But if you have any concern at all, if there's anything that you are maybe wondering about, is my testosterone low? Do I have these symptoms? Are my erections a problem? Do I have some urinary issues? We are more than happy to see anybody. And we have experts in every aspect of urology: stone disease, cancer, erectile dysfunction, infertility. We have experts on every one of these issues, and we'd be happy to see any patient that would want to come see us.
What is the question that most men are afraid to ask their doctors about as it relates to coming to you or their doctors? What do you think the most fearful question to ask?
Sometimes patients are coming to see us for other reasons, like you said, problems with their prostate, Psa screening. And oftentimes, if you don't ask about erections, patients won't bring it up. It's something that, even when you're in the room with the urologist with the door closed, it's something that's usually not brought up. So it's something that there's still, still not something that every man is forthright about. It's something that if you're having issues, please talk to us about it. It's something we want to know, and it's something that we are asking about now to try and prevent it from being embarrassed to ask about it.
Yes. So how does one get in contact with you if we want more information about what you do and where to go?
Yeah. So you can visit our website. If you, the website is kind of long, but if you look up Smith Institute for Urology, and we're at Northwell Health, the phone number to get in touch with us to schedule an appointment to see any one of us is 516-734-8500. That's the number for the Smith Institute for Urology. And we have people that are answering the phone that are very, very smart and understand your specific issues and can help put you in touch with the right urologist and the right person.
Tell me what would be if you had to leave a couple of words for the listening audience with regard to urology and care of their urologic system, what would you say? And I know you said drink a lot of water. Is water, I know people, they tend not to, I don't like to drink water. What else can we do? Is it electrolytes that I can drink? What can I take into my body that will kind of help to maintain the health of my kidney and the system? Water
really is the best. For prevention of kidney stones, sometimes having some citrus, so sometimes putting a little lemon juice in your water. But the message that I would send to your listeners with regards to urologic health, number one is if you have any question at all, don't be afraid to see a urologist. We are more than happy to come see you. The other thing I would say is Psa Screening. We still believe is a very important test. We recommend that men above the age of 55 get a test, and maybe earlier if you have a family history or specific or other risk factors. And that any problems with erections, low testosterone, these are things that we see every day. We have experts in them, and we know how to treat, and we're more than happy to treat any patient who has an issue.
So thank you so much for being here, Dr. Adam Cole, the urologist at Northwell Health Smith Institute for Urology. We hope you stay safe and continue to stay healthy. And thank you for being our guest today.
Thank you so much for having me. It's been a lot of fun, and I hope we get to do it again soon.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.